Welcome to the OHSA training, where we will guide you through essential life support and first aid procedures. Let's embark on this journey to enhance safety and preparedness. Recognizing first aid notices and signs is crucial. They guide us in emergencies, ensuring we respond effectively and safely. When providing first aid, it's important to understand your legal and ethical responsibilities. You must know when to continue or stop assistance. Consent is key in first aid. Learn about actual, parental, and implied consent to ensure you're acting within legal boundaries. First aiders must protect themselves from HIV and AIDS by avoiding contact with body fluids. Safety first. Material safety data sheets are vital for understanding chemical hazards. They inform and protect everyone on site. In any incident, first assess the situation. Ensure it's safe to approach the patient without risking your own safety. Engage with the patient by checking for hazards and offering help. Communication is key in providing effective aid. For unresponsive patients, check for medical alerts, breathing, heart activity, and skin condition to determine the next steps. Medic alert bracelets provide critical information when a patient cannot communicate. They speak for you when you cannot. Triage helps prioritize care based on the severity of the condition. Quick assessment can save lives. Keep emergency numbers handy. Quick access to EMS can make a significant difference in critical situations. Understanding the structure and function of the body is fundamental in providing effective first aid. The human body is a complex system of atoms, molecules, cells, and organs. Each part plays a vital role in overall function. Internal cavities like the dorsal and thorax protect vital organs. Knowing their locations aids in effective first aid. The brain, heart, and lungs are crucial for life. They control essential functions like coordination, circulation, and respiration. The stomach, intestines, and kidneys play key roles in digestion and waste elimination, maintaining the body's balance. The liver processes nutrients and detoxifies the blood, while the bladder stores and expels urine. Both are vital for health. The body comprises various systems like cardiovascular and respiratory, each essential for maintaining health and function. The cardiovascular system transports vital substances throughout the body, ensuring all parts receive necessary nutrients and oxygen. The heart is a hollow organ about the size of a fist, composed of muscle tissue. It's centrally located in the cardiothoracic cavity under the breastbone and is controlled by electrical impulses initiated in the brain. The heart's chambers and valves play crucial roles. The right atrium receives deoxygenated blood, while the right ventricle pumps it to the lungs. The left atrium receives oxygenated blood, and the left ventricle pumps it to the body. Blood, a red body fluid, is composed of 55% plasma and 45% cells. Red cells carry oxygen, white cells are immune warriors, and the body contains 5 to 6 liters of blood. Arterial blood is bright red, while venous blood is dark red. Pulse can be monitored at various points like the neck and wrist. It measures the rate and rhythm of heartbeats, with a normal adult pulse rate ranging from 60 to 100 beats per minute. The respiratory system feeds oxygen to the lungs and expels carbon dioxide. It consists of the upper and lower tracts, with gas exchange occurring in the alveoli. The musculoskeletal system allows movement, gives shape to the body, produces blood cells, and generates heat, supporting and protecting internal structures. The skeleton is a framework of connected bones and joints, providing the basic support structure of the body. Bones come in various types: flat like ribs, irregular like vertebrae, long like the upper arm, and short like the hand. Joints are where 2 or more bones connect, held together by ligaments, allowing movement. The nervous system, consisting of the brain and spinal cord, controls responses and is protected by bone. It gathers and transmits information to the central nervous system. The brain, part of the central nervous system, includes the cerebrum, cerebral cortex, cerebellum, and medulla, each responsible for various functions like thought, memory, and motor control. The brain's intricate structure is vital for its complex functions, from processing information to controlling bodily functions. The spinal cord extends from the medulla, transmitting signals between the brain and body, controlling motor instructions for movements like walking. The skin, the largest organ, provides a protective covering, senses pain and temperature, manufactures vitamin D, and helps in waste excretion. Body temperature should remain stable, affected by various factors. The average adult temperature is around 36.1 to 37.2 degrees Celsius, with readings possible in multiple body areas. Cardiopulmonary resuscitation, or CPR, involves the heart, lungs, and rescue breathing, crucial for reviving individuals in emergencies. The CAB method in CPR focuses on circulation, airway, and breathing with a compression-to-breath ratio of 30:2, performed until help arrives. For CPR on an adult, position yourself correctly with hands placed on the chest, shoulders directly over hands, and arms straight for effective compressions. Ensure safety with PPE. Perform fast compressions, pressing down smoothly, and continue until EMS arrives to take over. When performing CPR with two rescuers, coordination and the use of PPE are essential to ensure effective resuscitation. Air passes through the mouth and nose, around the tongue, and into the lungs. It's crucial to keep the airway clear for normal breathing or during CPR. Breathing can stop due to various reasons like choking, carbon monoxide poisoning, drowning, or heart attacks. Recognizing these causes is vital for timely intervention. The head tilt/chin lift maneuver is essential to clear the airway, ensuring that the tongue doesn't block airflow. After chest compressions, if the patient isn't breathing, open the airway using the head tilt/chin lift, pinch the nostrils, and give 2 slow breaths, watching for chest rise. Always pinch the nostrils closed and use personal protective equipment when performing rescue breaths. Placing a patient in the recovery position helps maintain an open airway and prevents choking if they vomit. Choking is often indicated by a person clutching their throat. Quick removal of the obstruction is crucial to prevent severe consequences. If you can see the object causing choking, carefully remove it. If not, perform the abdominal thrust to dislodge it. Do not slap a choking person between the shoulders, as it may worsen the blockage. Instead, use proper techniques to clear the airway. Stand behind the patient, wrap your arms around their waist, and perform upward thrusts to dislodge the object. Each abdominal thrust should be forceful enough to expel the object. Continue until the object is out or the patient becomes unresponsive. Make a fist with one hand and grasp it with the other to perform effective abdominal thrusts. Ensure each thrust is strong enough to clear the airway, using the correct technique to avoid injury. For pregnant or obese individuals, perform chest thrusts instead of abdominal thrusts to avoid harm. Conduct a secondary survey, start CPR if needed, and call for emergency help. Place the patient in the recovery position if the object is dislodged. Shock deprives organs of blood, leading to potential damage or death. The body constricts blood vessels to protect vital organs. Shock can be psychological, causing anxiety or traumatic, with symptoms like shallow breathing and weakness. Recognizing these signs is crucial. For conscious patients, lay them in a half-sitting position and treat injuries. For the unresponsive, start CPR and call for emergency help. Lay the patient in a half-sitting position to aid recovery and ensure comfort while waiting for medical assistance. Fainting is a brief loss of consciousness, often due to low blood pressure, while unresponsiveness can indicate more severe conditions like coma. In emergencies involving fainting or unresponsiveness, start with a secondary survey. Call for help and EMS for hospital transport. If the person is breathing, try to get a response. If there's no response, gently shake them and place them in the recovery position. Conduct another survey and treat any injuries. If they're not breathing, begin CPR immediately. Traumatic bleeding results from injuries like contusions, cuts, or abrasions. It can be major or minor, external or internal. Recognizing the type of bleeding is crucial for effective treatment. External bleeding severity depends on the blood source. Arterial bleeding is bright red and spurts out, while venous blood is darker and may flow steadily. Capillary bleeding oozes from the wound. Uncontrolled major external bleeding can lead to shock or death. Blood clotting is essential to stop the bleeding, achieved by applying direct pressure. Immediate medical attention is needed for puncture wounds to vital areas. When dealing with major external bleeding, such as from a broken glass window, it's vital to control the bleeding quickly and efficiently to prevent further complications. Conduct a secondary survey and wear protective gear. Clean the wound without delay and apply direct pressure using sterile dressing. Elevate the injury and treat for shock. Call for help and EMS for transport to the hospital. Avoid using a tourniquet unless necessary. Raising the injury above the heart level can help control bleeding by reducing blood flow to the area, which is a crucial step in managing major external bleeding. Minor external wounds, like abrasions, require less intensive care, but should still be cleaned and monitored to prevent infection and ensure proper healing. Internal bleeding can manifest as pain, tenderness, bruising, or swelling in the affected area. Symptoms may include shock, dizziness, or vomiting blood, requiring immediate medical attention. Bruising in the affected area is a common visual sign of internal bleeding. It's important to monitor these signs closely and seek medical help if they worsen. For internal bleeding, conduct a secondary survey and treat visible injuries. Apply an ice pack to bruised areas and monitor the patient until EMS arrives. Call for help and ensure transport to the hospital. To manage a nosebleed, have the person sit with elbows on their knees and apply pressure inside the top lip. Use a clean cloth under the nose and an ice pack on the bridge. Seek medical advice for frequent nosebleeds. Images show effective techniques for managing nosebleeds, emphasizing the importance of proper pressure application and positioning to control bleeding. When dealing with an impaled foreign object, conduct a secondary survey and call for EMS. Do not remove the object. Secure it with bulky material, apply an ice pack, and treat for shock. Securing an impaled object minimizes movement and prevents further injury. This is a critical step in first aid for such injuries. Use a long piece of cloth to wrap around fingers and create a ring pad. This technique helps stabilize the impaled object and prevent further damage. Treat an impaled object as you would an open fracture. Stabilize the object and prevent movement to avoid further injury. In the event of an amputation, conduct a secondary survey and control bleeding. Preserve the amputated part in a clean cloth, seal it in a plastic bag, and place it on ice. Call for EMS and monitor the patient. Conduct a secondary survey, control bleeding, and treat for shock. Preserve the amputated part properly and ensure quick transport to the hospital. Monitor the patient closely. Eye injuries require extreme care. Do not attempt to remove embedded objects or apply pressure. Avoid using cotton swabs or tweezers on the eye itself. Seek professional medical help immediately. When dealing with a foreign object in the eye, it's crucial to conduct a secondary survey and keep the patient calm. Avoid trying to remove the object or applying pressure. Instead, cover the eye with a sterile dressing or cloth, and if possible, tape a paper cup over the injured eye. Always call for help and ensure the patient is transported to a hospital. For cuts, scratches, or blows to the eye, it's important not to apply pressure to control bleeding. This can cause further damage and should be avoided at all costs. In the event of chemical exposure to the eye, conduct a secondary survey and call for emergency services. Use appropriate personal protective equipment and utilize the eye wash facility. Keep the eyelids open and flush the eyes with running tap water for at least 15 minutes. If necessary, have the victim take a shower and remove contact lenses after flushing. Cover both eyes with a sterile dressing or cloth. Burns are categorized into 3 degrees based on severity. First-degree burns are caused by sunburn, steam, or hot liquids, resulting in red and sore skin. Second-degree burns involve very hot or boiling liquids, leading to blisters and red skin. Third-degree burns are caused by flames or very hot surfaces, resulting in black, charred skin and tissue. Thermal burns can occur from incidents like boiling liquid spills. These burns require immediate attention and proper first aid to prevent further injury. Electricity burns are a severe form of thermal burns, often resulting in extensive damage. Immediate medical attention is crucial in such cases. For thermal burns, use appropriate personal protective equipment and conduct a secondary survey. Cool the burn by immersing it in water for at least 30 minutes. Maintain body temperature and cover the affected area with a wet dressing or pad. Treat for shock and avoid removing clothing stuck to the burn. Do not apply oils, creams, or break blisters. Always call for emergency services. It's important not to break blisters that form from thermal burns, as this can lead to infection and complicate healing. Chemical burns can occur from substances in liquid, powder, or gas form. It's essential to study the material safety data sheets in advance and follow the treatment instructions on labels and packaging. Learn to operate emergency showers and eye wash fountains and always wear personal protective equipment. Follow all safety precautions and procedures. In the case of liquid chemical burns, use personal protective equipment and conduct a secondary survey. Follow the instructions on the material safety data sheets and remove or dilute chemicals using an eye wash or shower. Rinse the contaminated clothing by cutting it away and wash gently with soap. For chemicals in the eyes, flush for at least 20 minutes and avoid applying ointments. Cover the burnt area with a clean, damp dressing and call for emergency services.